In 1990, the country of Rwanda faced 4 long years of civil war, ending in a genocide which left an estimated 1 million dead and 2 million displaced. The world community could not have predicted the resilience with which the Rwandan people responded to the tragedies of their past. And so, inspired by their strength, many have chosen to aid in the Rwandan path of progress. As the country of Rwanda continues to grow, there are areas that still need a helping hand, most notably healthcare. 2 Georgia College graduates, Jonny Golden and Zachary Rader, are on a mission to contribute.
Me and Zach had this idea and we were just thinking how far off it could be, but the reality is people do things like this. I had been to Rwanda before and saw just a mass healthcare need. We put our ideas together and said we're going to do something awesome this year. We're going to go to Rwanda and try and put in a health clinic in an area that's very underserved and remote from any type of healthcare in existence. We've been talking for months about this whole do good health idea and quickly realized that the best way to make anything happen was to book a ticket and head over to Rwanda. This was an area far from care. We knew that the community there had 20 hours walking to the nearest hospital, and they really hadn't experienced medicine or modern medicine at all before. We found that 97% of women had no type of maternal care in their life. Close to 95% had never had eye testing. 79% of kids under 12 had never had any medical care in their life, and they had nowhere to go. So Zach and I came back from Rwanda clearly seeing the need, having backing from the Rwanda National Ministry of Health, and knowing that we had about a year to turn this into something. So we will build the medical center. The Ministry of Health will come and staff it, operate it, do all the medications through a joint partnership. For fundraising, we wanted to connect people here with a clinic in Rwanda in a way that they could take ownership. So businesses here will have a direct sponsorship of a room in Rwanda. They'll have their business name on it and they will make an impact for generations to come. We raised most of the money for the clinic. We're at the spot where we could break ground. This trip was very special to me because I showed up, just wondering how all this work over the last year would come into play. And I got to this clinic site overlooking the beautiful Lake Kivu and saw our contractors out there, Ministry of Health officials out there. Saw over 100 community members just working to clear the land because they wanted this thing to happen. I saw the excitement they had, and I got to feel some of that excitement myself and know that we were doing the right thing. Thus far, over the last 8 or so months, we've raised 75 of the 95,000 required to make this clinic. We have all the funding for the clinic itself, but now we're just adding on external bathrooms, a community kitchen, a community garden, fences, retaining walls, all that kind of stuff. We're excited to, move forward and accomplish this remaining goal in the next 3 months before opening.